Hello everyone. So I am Dr. Ajay Budhwa, the consultant diabetologist from Amritsar, running my own center by the name of Dr. Ajay Budhwa Diabetes Clinic in Amritsar. So today I am going to talk about a very important session. Number of my patients, number of other colleagues have been discussing that how the diabetes and heart related issues are interlinked, whether is it the increased risk of heart diseases in diabetic patient? Are these people at more risk for hypertension, for cardiac diseases? And most important part of our today's talk will be how to take care of your heart if you are suffering from diabetes. So at present we all know that heart disease is being the leading cause of mortality and hospitalization in patients who are suffering from diabetes. So what it involves and what are the proper steps which we should take to reduce the risk of heart disease, not only in the diabetic population but also as a general, the people who can take those or they can do the modification in their lifestyle to involve those. So heart disease in general, you know that it occurs when the blood circulation to the heart is lesser or stopped or slowed down because of some blocked arteries. So I'm not talking in the medical terms, I'm just going through the layman terms so that we can make understand the normal public that what actually it is happening. So what are the reasons behind this heart blockage and why this is happening? So one of the major risk factors for this is diabetes. We all know that there are certain risk factors for the increased cardiac diseases, heart diseases. One of them is with the increasing age, another is hypertension, another is smokers, and a very important aspect is diabetes. We all know that India being the capital of diabetes and as population is increasing, so number of people who are suffering from diabetes, they are increasing day by day. So now let us understand what does this diabetes mean, that what is actually it is, since it has become a lifestyle disease. So many new people even at the younger age are getting diagnosed with type 2 diabetes. So diabetes is a lifestyle disease which affects our body to control the blood sugar level. So in simpler words, it is the condition in which body has excess of blood glucose in our blood. So let us understand why this is happening, why body is unable to utilize that blood glucose. So usually when we are eating the food, the glucose from the food enters our bloodstream. Further, the insulin, which is a hormone which is present in our body, many of you must be knowing that even when body is unable to make the insulin, we recommend the insulin to the patient. So when this glucose enters our blood circulation, so insulin is secreted and it breaks down the glucose from blood into our cells to be stored or used for the energy. So this is not that glucose is bad, it is needed for our day-to-day activities also, and it is required to sustain life. So with diabetes, our body itself does not make either the enough insulin, nor there is a term insulin resistance, that body can't effectively use the insulin to break down the glucose. Many of you must have heard the term the insulin resistance. So insulin is present but body is unable to utilize that. So this leads to the high blood glucose levels in the blood and leading on to the diabetes. So did you know that the diabetes can increase our chances of heart disease? The increased not only morbidity, the mortality. The mortality means the risk of dying from cardiac diseases, from heart diseases. So this is true. With diabetes, you are more likely to have cardiac related illness. You are more likely to have, in layman terms, a heart attack. So when it comes to diabetes, prevention is very important as it can affect your whole body from head to toe. All the organs, whether they are eyes, whether they are kidney, whether they are feet, whether they are brain, whether the cardiac system, whether the intestine. So all organs can be affected by diabetes, which we call as the complications of diabetes. Many times you must have heard that शुगर ने किडनी पर असर कर दिया, शुगर ने हार्ट पर असर कर दिया, शुगर ने आंखों पर असर कर दिया. But there are much more complications apart from these. So in fact, generally what I will say that the people with diabetes are 2 to 3 times more likely to have heart related issues or stroke. Even stroke refers to the paralysis. In general terms we say that paralysis of one side of body. There are various other presentations of stroke also. So these people, the people suffering from diabetes, are at increased risk as compared to the general population who do not have diabetes. And it is reported that among the people who are above the age of 65, the approximately 65% of the people die from heart related illnesses. So chance of developing heart disease among the people with diabetes is not dependent on how you well manage the diabetes. So this is very important concept or myth I would like to highlight, that many times people are saying that their diabetes is very well controlled, but how it has affected their system. So this is important aspect I will be talking in next few minutes. So when we think about diabetes, we should really be thinking about heart disease as well. So it is not only the control, although the control of diabetes is very important. With better control, जब हम शुगर को कंट्रोल रख रहे हैं, हमारे जो चांसेस है हार्ट डिजीज के या अदर कॉम्प्लिकेशंस के वो कम होते हैं. But the duration of diabetes is also as important as the control. So now moving on, let us see how blood sugar leads on to the heart related illnesses. We all know that high blood glucose can damage our blood vessels. It can worsen the cholesterol levels. When specifically talk about diabetes, we call it diabetic dyslipidemia, and make the blood pressure, the hypertension more difficult to manage. Many people with diabetes have a resistant hypertension. So this persistent cycle of high blood glucose, worsen cholesterol levels and high blood pressure can lead on to the atherosclerosis. So blood vessels are prone to atheroma. So this condition is the narrowing of blood vessels due to collection of bad cholesterol plus the other various underlying changes which are occurring in the body because of diabetes and its complications. So when the blood vessels get narrow, the blood flow has trouble reaching the different organs of a body including the heart. So sudden stoppage, when this blood flow to an organ suddenly stops, it might lead on to a heart attack, which we call it a myocardial infarction. So there are a number of things you can do to lower this risk of heart diseases. So understanding the connection between diabetes and heart diseases is the first step towards the prevention. So this is important. So basically in medical science there are three types of prevention: primary, secondary and tertiary. But here I am going to focus on the primary prevention. Primary prevention means for those people who already are suffering from diabetes but they have not developed any heart related illnesses. And when we talk about secondary prevention is when people had developed some complication already and we have to re-prevent it. So diabetes commonly, as I told you, is referred to as now lifestyle diseases. So managing diabetes requires patient's significant effort, involvement of the patient and changes in his or her lifestyle. And these changes require a lifelong commitment from the patient. Even now I am running my diabetes reversal program where the lifestyle and the certain things, the dietary habits are very important for the patient. Obviously it is not possible, the reversal of diabetes, it is not easy, but in certain cases we have been able to do it in type 2 diabetes with the lifestyle, with nutritional habits and with the exercise control in certain subset of the patient, not in all patient. So most important part being control of the blood sugar levels, changing the lifestyle by eating healthy food habits, engaging in physical activity, regular blood glucose monitoring, we call it as the SMBG, that is self monitoring of blood glucose. So एक ये चीज बहुत इंपॉर्टेंट है कि डायबिटीज जब किसी को भी हो गई है, ये नहीं है कि डॉक्टर ने मैनेज करनी है, पेशेंट के फैमिली मेंबर्स, एवरीवनस इन्वॉल्वमेंट इज नीडेड देयर. SMBG कोई भी गाइडलाइंस है, चाहे वो अमेरिकन गाइडलाइंस है, चाहे वो यूरोपियन गाइडलाइंस है, चाहे वो इंडियन गाइडलाइंस है, उसमें हम सबसे ऊपर बिफोर राइटिंग एनी मेडिकेशन आई राइट MNT, that is the medical nutrition therapy, which includes exercise and your dietary habits. And next part is SMBG, that is the self monitoring of blood glucose. ये नहीं है कि आज डॉक्टर को दिखाया जी, महीने बाद उसकी ब्लड शुगर चेक कर ली है, and then the patient is coming after 3 months and in between he or she has not checked any blood sugar. So always focus your patients on SMBG, that ये चाहिए. So now next part is that what is the strategy, what are the preventive strategies to prevent this. So I generally call it as the ABC of diabetes. So each word here is specifically. So A refers to the HbA1c, A1c test. Most of you must be aware that who are suffering from diabetes that डॉक्टर कहते हैं जी अपना 3 महीने वाला ब्लड शुगर चेक कराओ, हम एवरेज शुगर देखते हैं क्या है. So we refer to as the HbA1c. So it measures your average blood glucose over past 3 months. And you need to know that your blood sugar levels over the time. So in most of the population our goal is below 7. बट जरूरी नहीं है कि ये 7 ही गोल है. सो जो आपका प्राइमरी कंसल्टेंट है, इन सर्टन केसेस हम इसे प्लस माइनस करते हैं. फॉर एग्जांपल आपको कोई किडनी रिलेटेड इशू है, आपको कोई लिवर रिलेटेड इशू है, जब आप एल्डरली हो, योर एज इज मोर देन 65. सो इन सच पॉपुलेशन आवर एम इज नॉट ओनली कंट्रोल ऑफ ब्लड ग्लूकोज, बट इन सच पॉपुलेशन आवर वेरी इंपॉर्टेंट पार्ट इज टू प्रिवेंट द हाइपोग्लाइसीमिया. मतलब शुगर कम भी नहीं होने देनी, बिकॉज अगर पेशेंट हाइपोग्लाइसीमिया में जा रहा है तो उसके अपने साइड इफेक्ट्स हैं. इट ऑल्सो इंक्रीजेस द कार्डियक risk. So we have to manage. But in general, if we talk about general population, so our goal is 7 for people who are suffering from diabetes. So now next B of this ABC of diabetes is the blood pressure. So blood pressure is basically the force of the blood against the vessels of your body. So if your blood pressure gets too high, it make your heart work too hard. For example, एक पाइप है पानी की. I'm just giving an example to make the people understand. अगर पाइप से ज्यादा फ्लो के साथ पानी जाएगा तो वो पाइप उतना ज्यादा प्रेशर देगी. बट अगर उसके साथ स्मूथली फ्लो जाएगा तो वो पाइप स्मूथली चलती रहेगी. और अगर ज्यादा प्रेशर है तो काफी चांसेस है कि पाइप जहां पर उसका प्राइमरी पॉइंट है, द पॉइंट फ्रॉम विच द वाटर इज कमिंग, कैन गेट ब्रेक डाउन. सो सिमिलर इज द केस विद आवर हार्ट. So blood pressure goal for most of the people with diabetes is below 140/80. And for example, अगर diabetes आपको किडनी पर असर कर रही है, people has developed diabetic nephropathy. So in such cases our goal become more stringent, more tight control of blood pressure, 130/85. And obviously it might be different for certain population. So next C for diabetes is the cholesterol. We know that diabetic dyslipidemia, very common condition. So C here refers to cholesterol. Basically we know there are two types of cholesterol for general, good cholesterol and bad. Good refers to the HDL. LDL is the low cholesterol, and there are other types of cholesterol also these days. I won't be going into details of those. There is total cholesterol, there is triglycerides. So triglycerides are specifically raised among the diabetic population, and we label it as the diabetic dyslipidemia. In diabetic population, good cholesterol is low, your HDL is low, your LDL is the high. LDL is the what we say that सबसे अगर कोई पूछता है कि बुरा कोलेस्ट्रॉल कौन सा, तो we call it as the HDL. And most of the guidelines में हम HDL के साथ चलते हैं कि डिपेंडिंग अपॉन योर ASCVD रिस्क, आपको एथेरोस्क्लेरोटिक कार्डियोवैस्कुलर डिजीज का क्या रिस्क है, उसके अकॉर्डिंग हम आपकी सेट करते हैं आपकी ड्यूरेशन ऑफ डायबिटीज. कि आपको पहले कोई हार्ट रिलेटेड इशू है, आपको स्ट्रोक हुआ, कोई सेरेब्रोवास्कुलर एक्सीडेंट हुआ, उसके अकॉर्डिंग हम उसको ज्वाइन कर देते हैं. सो LDL इज द बैड कोलेस्ट्रॉल विच कैन build up in your body and it can clog your blood vessels, so it can lead on to heart attack or stroke. HDL being the good cholesterol, and it removes the bad cholesterol from your blood vessel. So it varies from different to different goals. क्या है भी HDL, हमें in general हमें हमारा एम होता है कि इसे below 100 रखें HDL अगर कोई डायबिटीज से सफर कर रहा है. बट in certain subset of the patients we have to control it below 70 also. So eat healthy and balanced diet. So that was the ABC of diabetes. So next important aspect is कि डायबिटीज के लिए हमें प्रिवेंशन के लिए क्या करना है, हेल्दी खाना खाओ, बैलेंस डाइट स्टाइल रखो. तो देयर इज नो वन साइज फिट्स ऑल के हमने एक दे दिया है. बहुत बारी आई हैव सीन दैट एक किसी को एक डाइट चार्ट दिया, पीपल आर शेयरिंग इट टू अदर पीपल. वो ये नहीं जानते कि सम माइट बी हैविंग सम किडनी रिलेटेड इशू, किसी के लिपिड पैरामीटर रेंज हो सकते हैं, किसी का HbA1c लेवल डिफरेंट हो सकता है, उसे कोई कोमोर्बिडिटी हो सकती है. सो नेवर डू इट. एंड इवन आई हैव सीन दैट पीपल आर शेयरिंग द मेडिसिन ऑल्सो, दैट इस गोली से मेरी शुगर कंट्रोल होगी, ये कर लो. सो दिस इज वेरी आई थिंक irregular thing not to be done. So always eat more of salad, fruits, but it is the quality and quantity both matters. Don't eat in a more quantity. Quantify your food, quantify your fruits, quantify your vegetables. Have a regular meat pattern and make healthy food choices. Your fat and your carbohydrate intake are crucial for managing diabetes as well as heart diseases. So make simple switches from saturated to unsaturated fat. So this is very important, that people say that भी कौन सा fat अच्छा है, कौन सा fat बुरा है. So we have to shift to the unsaturated fat which has more omega fatty acid, omega 3, omega 6, omega 9. Because having too much blood sugar can ultimately lead on to rise in the blood cholesterol level. So it is important that we eat in such a manner. So switch from butter and ghee. How next चीज जो सारे जाने पूछेंगे भी करें क्या, इसका अल्टरनेट बताओ. ये तो बता दिया कि अच्छे फैट्स का. So switch from ghee and butter for the unsaturated vegetable oils and spreads such as sunflower, olive oil, rapeseed or corn. So this is, I think, important choices, that sunflower oil, olive oil, these are the good substitutes for butter and ghee. So trim the visible fat from meat and remove the skin from chicken. This is especially for the people who are very fond of eating non-veg. So this is especially for them. Then trim the visible fat from meat and remove the skin from chicken. So choose low fat milk. So this is a very, I think, important advice which I give to most of my patients these days. We have a yellow milk available which is low मिल्क. और अगर लोग कह रहे हैं कि हम घर का मिल्क ले रहे हैं तो उसमें अब ये कह सकते हो, यू कैन रिमूव दी, उसे 2 बार यू कैन बॉयल इट एंड रिमूव द फैट फ्रॉम इट, and so that the fat content of the milk becomes less. And definitely taking milk is an important aspect of dietary. So swap biscuits, cakes and chocolates for healthier snacks such as fruits. Avoid eating such things like bakery foods, cakes, biscuits, chocolates. They are having very high glycemic index. So remember, fatty foods are high in calories and excess of this energy can result in weight gain. So to help you manage your weight gain, it's also important to keep an eye on total amount of fat you are consuming, because if you are consuming more fat, you are taking more calories and it will ultimately lead on to the more weight gain. So it is not only that we are managing diabetes, so we are managing the complications of diabetes. It is not HbA1c. These days I use the term kg-A1c, that weight, kg for kilograms, A1c for HbA1c. So we have to manage all these aspects. So different fat types, as I have already told you, have different effects on our body. So now eat right. What is the right pattern? So avoid refined white breads and cereals, potato chips, fried, red meat, processed meat. Highly processed food is leading on to more spikes in your blood glucose, more weight gain, rise in your lipid level, bad cholesterol and leading on to weight gain. Avoid the sweetened beverages. Instead of taking juices, take fruits. So this is very important advice. Many times people are thinking कि यार juice पी रहे हैं ये बहुत अच्छा सेहत के लिए. No, instead of taking juice, go for fruits. So eat food with more fiber, whole grain cereals, dairy foods with low fat, beans, legumes, fish, nuts, healthy oils जैसे मैंने बताया, olive oil. Choose foods as fruits, leafy green vegetables, breads, cereals and low fat or skim milk and cheese. Cut down on salt. So this is another important thing, because when people are coming with high blood pressure, no one is taking precaution to reduce down your salt. So there is a medical term for it, DASH, that is dietary approach to stop hypertension, the most important aspect of which is cutting down on salt. So too much of the salt is linked with high blood pressure, which is a major risk factor for heart disease. In fact, I would like to highlight that the most common cause of heart failure all over the world is hypertension, because hypertension itself leads on to heart failure. So most of the salt which we are already eating is in processed foods. So check the labels. Often if you see a label of your, let us say chips, let us say any bhujia, the level of salt is definitely mentioned. So check the label and go for those with the lower salt content, and you should learn that how to make the healthy choices. So remove the salt shaker from table. अगर आपके टेबल पर, आपके डाइनिंग टेबल पर सॉल्ट बढ़ा, उसे रिमूव कर दो. अदरवाइज हमें आदत है हाई सॉल्ट लेने की. So we can avoid eating or adding up the extra salt. So try adding flavor to your foods like herbs, spices, black pepper, lemon juice in place of salt when cooking. So in general, some tips which should be considered for all diabetes is eat balanced meals, eat a reasonable amount of calories, eat regularly at right time, do not skip a meal. So this is very important concept, that people are skipping meals to break down your glucose. This is also wrong for the diabetic people. And eat slowly, choose your food properly. So next important part is try to maintain a healthy weight and engage in a regular exercise. Because अगर डायबिटीज है तो बड़े लोगों का वेट गेन हो रहा है और हम सब बोलते हैं कि वेट गेन है तो वेट कम करो कम करो कम करो, बट इट इज आई थिंक द मोस्ट डिफिकल्ट पार्ट फॉर मैनेजिंग डायबिटीज इज reducing your weight. Even patients are putting effort, but they're still unable to control the weight. These days we have a certain set of medications also, which you can discuss with your treating doctor, which help us to reduce the weight also along with managing diabetes, and they are very safe for your heart, they are safe for your kidney. So when we try to reduce weight, it improves our insulin resistance, it improves our lipid levels, it removes the bad cholesterol, it helps us to improve blood pressure levels, and it helps us to better control of diabetes. So always start with low intensity short duration workouts and gradually increase your intensity. ये नहीं है कि पहले दिन ही आप 10 किलोमीटर चल रहे हो, no, never. So recommendation is कि 30 to 40 minutes a day आप walk कर सकते हो. 150 minutes of aerobic exercise and brisk walking is recommended by the American Association of Clinical Endocrinology, American Association of Cardiovascular Disease, and American Heart Association. So now next important part is the medical treatment of diabetes. So obviously जिनकी शुगर नहीं कंट्रोल हो रही, with medical nutrition therapy, that is exercise and the dietary pattern they are following. So we have to go for the medication, the pills, and this has to be decided by your doctor depending upon the comorbidities. आपको कोई किडनी रिलेटेड इशू तो नहीं है, आपके न्यूरोपैथी तो नहीं है, आपको लिवर रिलेटेड इशू तो नहीं है, या आपका कोई वेट गेन हो रहा है, वेट कम हो रहा है. सो डिपेंडिंग अपॉन दोज, कोई हार्ट रिलेटेड इशू विद डॉक्टर, देयर आर नंबर ऑफ ओरल hypoglycemic agents which are available, and we choose those agents accordingly. So always take your medications as prescribed by the doctor and visit your doctor regularly. And always remember that there is a risk of hypoglycemia if you delay your meals or eat less than usual. So this is very important. बहुत बारी पेशेंट कह रहे हैं हमारी शुगर कम हो गई है गोली खाने से, बट वो ये नहीं बताते कि हमने मील स्किप कर दिया था, जो उस दिन कम खाया था. So medications must be supported by healthy eating and regular physical activity and fixed pattern. So next is smoking and alcohol. So people who are suffering from diabetes, and even in general population also, the people even who are suffering from heart disease, quit smoking, stop harmful use of alcohol. Many people with diabetes do smoke, and we know that smoking, as I told you in the starting of our talk, that smoking is a major risk factor for heart disease, and also leads on to development of type 2 diabetes, and further leads on to development of diabetic complication. It increases the requirement of insulin, and it increases the risk of hypoglycemia. So smoking cessation is an important part of diabetes care. So cope with the stress as best as you can. So next is stress. So stress has become a part of our lifestyle. Everyone is having some sort of stress, but it becomes troublesome when the stress gets in your mind. It is disturbing your life, it is disturbing your sleep. So try to reduce your stress, and we all know that stress can lead on to increased blood glucose levels. So try meditation, try deep breathing. Oh, there are few more relaxation techniques to beat the stress in a healthy way. So quality sleep is another important key to good heart health and managing diabetes. The people who sleep well more than 8 hours, they live longer as per the few studies. Spend time with your friends, because there has been a recent study which has been published that from Europe, that the people who spend time with their friends, they live longer. So this is a very important study I would like to highlight, because it helps us to cope down our stress level. So try to share those negative feelings with your friends, with your family members, so that you can cope up with this stress, and try to get 7 to 9 hours of healthy sleep. So now, bottom line, what I would say to conclude is that diabetes can lead on to the serious medical conditions. It can lead on to various complications, including heart disease, but you can manage the conditions well with medications, as well as the lifestyle changes involving exercise and the dietary habits. And by using all this, we can avoid the most diabetes related complications with this. So obviously it is not possible. There are certain genetic factors which are involved, there are certain familial factors which are involved in it. It is not possible that we can prevent also, but at least what we know, we can put our best effort to prevent those complications, or even if those complications are occurring, we can try to manage those complications. So thank you very much for listening to me patiently. अगर कोई भी किसी को query होगी, I will be sharing my email and other IDs. You can always email me and let me know. So thank you very much. Thank you.
Recording stopped.
Hello? Hello?